Thank you very much for the organizers for the invitation. And also, I would like to thank all the people that they are looking at us from their home, from different places around the world. We are very lucky that we have this live streaming of this Congress. So people from different countries are with us, and we thank them very much. So, as you heard, my name is Konstantina Theodoratou, and I decided to talk to you about addictions, something that we meet very often in the clinics. And of course, you can ask me why addictions. We are talking about pain in this Congress. But you will see, yes, it's a little bit dangerous. But you will see what is the connection between pain and addiction, and if we have things to say or if we can use acupuncture on that. I am a general practitioner. I'm a doctor, studied acupuncture in China for 4 years, and my main topic was pain. But when I returned to my practice in my country, I continue my studies in clinical psychology. So my practice is very related with the psychological problems. And what I do actually is that I combine different types of treatments, and acupuncture is one of those, with the Western medicine, and I treat my patients. So I decided to talk to you, as I said, for addictions, because addictions and pain are very much related. They have some common parts referring to the Western medicine, but also to some modern sciences like the neurosciences. So there are common topics and common areas between these two problems. Let's give the definitions first. Concerning pain, of course, you have heard a lot of things. We know what is this. Pain is an emotional experience. So it's not only related with the sensory, something related with the physical body, but it's also with our psychological state. It's very closely related, and mostly the chronic types of pain, because we know that chronic pain is not only the pain in the body, but also is a change of behavior. It's a behavioral problem. So these are also related. Let me remind you that we have 3 different types of pain. The first one is the physical pain, the one that we mostly as doctors study and we treat with the Western medicine, giving the drugs. But apart from that, we have 2 other types of pain. The first one is the social pain, recognized today, which is the feelings that we have when we do not feel good in our social environment. And the third one is the psychological pain or emotional pain, as we said, which also does not have a physical problem or symptom. And this is the bad feelings that we have when our pleasant circulation in our brain, system in our brain, does not work properly. And we know that this system in our brain is very important for our survival. That means that emotional pain is very, very important for our survival too. So what's the point of this? The most important thing is that all these different types of pain, the 3 different types of pain, they actually have the same systems in our central nervous system. You're going to see that even if it's a physical pain or an emotional pain, we use the same neurotransmitters, we use the same brain system. And this is very important for us because we can use the same treatments in order to treat our patients. We can give a painkiller to treat an emotional pain. So, as we said, emotional pain is something really, really very powerful. We can see this in the clinics. We can see people that they come to us with emotional pain and they say, I suffer, I feel a pain, but we don't see this pain. We cannot make tests to find out this pain, but we must treat this pain. So, what's the important thing for the addictions and pain? Today, we have a new definition about addictions, and this definition is very much related with pain. You know, they are not addictional substances or habits. You know, food is not addictional to everybody, but to some people it is. They eat a lot. Even painkillers, even smoking is not addictive to anybody, but to some people it is. And that means that it's not the substances that are doing the addiction, but the person itself. So we are looking to find what's the problem with the person. What does this person has, and slowly becoming an addictive person. And if you look through all these systems, you're going to find that this person has an emotional pain behind its problem. And they use these addictional substances or habits in order to calm down their psychological pain. So the correct thing in medicine is not calling these diseases as addictions, but as painful behaviors. And that's the reason why everything in addiction is a painkiller. Alcohol is a painkiller. Nicotine is a painkiller. Drugs are painkillers. So we will see now what the modern science says about that and what's the connection with acupuncture. So today, recently, the last decade, we have a new part of medicine, call it addiction medicine, not in the whole world, but in some parts of the world, like USA and in some countries. And doctors, they need some extra training in order to become the doctors for treating these addictions. So it's a part of medicine, like pain medicine or sports medicine or other modalities within Western medicine. The new definition started in 2013 for addictions. Up to that moment, we used to say that addiction is the use of a substance, something like that. But today, we do not call them addictions, but behavioral addictions. That means that this is a problem of behavior and not of taking some pills or drinking some, eating something. So we call addiction a biological process that is pathological and alters the way that pleasure systems in the body works. So we go back to brain and we go back to this very powerful system, the pleasure system, which is common in all mammals, and that's why the mammals are very keen to become addictive. The very interesting thing is that different types of addictions have the same pathology and the same biochemical changes in the body, and that's the good point of us, because maybe we can treat them similarly with the same way. So we keep in mind that addiction is a change of a behavior, and the person has a habit, let's say, to do something continuously which is not fun anymore. It's not pleasure. In the contrary, most of the times it's harmful. If the people come to your clinic and they want to quit smoking, they're going to tell you that I don't like smoking anymore, but I cannot quit. So addiction is not pleasure anymore. It's something bad. And in psychology, we say that we should have the 3 C's, as you can see: craving, control, loss of control, and continued engagement with the same thing, with the same habit. So as we said before, we have 2 things in all addictive persons. The first one is that they want to do something that is going to reduce their pain. And the second one is that they turn to do this. Not all of the people want, if they have a pain, they become addictive, but some people, they do. So we need to individualize our diagnosis on the center person. So it's not quitting smoking similar to all people, cannot be reducing weight. We cannot use the same treatments to different personalities. So what's interesting here is that we need to stop the pain of this person, certain person, but we need to personalize our treatment. So you can see in psychology and neuroscience of psychology, we have seen how most of the people, they turn around their habits and how they become addictive from the, the first use or the first turn to do something until they become addictive. I will not spend your time with details like that, but I would like to mention here that it's really, really very important to understand what is this type of behaviors, because it's not only related with people or with treatments for addictions, but it's a global problem. It's the way we react to our environment and to the drugs that we use, to the food we eat, everything. And everybody of us has habits, good or bad. So controlling these habits up to a point, it's something really, really very important for us, for the balance of the doctors, for the wellness of our patients, but the whole earth too, for the whole planet. It was a very interesting colleague, a psychiatrist from the last century. He was the one who said that Western medicine doesn't know anything. He didn't like to believe that there is schizophrenia or mental diseases. So he said that only we need to personalize the treatments and to listen our patients, to listen the emotions and everything. And he said that only one thing is, only one type of pain is sure that we cannot avoid in life, to avoid pain. That means that the people, the man, and the pain is something very close by. We born up and we start feeling pain, different types of pain, and we have fears for the future. Or you heard in the morning lectures about anxiety and depressions. Everything of those different stimulations or feelings are related with the pleasure centers in our brain and becomes better when we give them pain treatments, when we give them painkillers. So it's really very important to learn what we can do. Now, what are the types of addictions? Most common are related with everyday life. That means the food, drink, social events, relations, sex, but new types, modern types, are now the internet, the hours that we spend in front of a computer, it's work. We can be dependent and addictive from our work, shopping, sun exposure. It was a very nice research in US about sun exposure and the addiction that people have from the sun. Shopping, we know very well. Even power. We know that powerful men from the history, they were addictive and they couldn't stop having more power. So everything in life is related with this procedure. The good thing is that the biology of the brain is the same on different types of addictions. It doesn't matter if I am addictive on money or food or drugs or whatever. The same neurotransmitters and the same systems are activated. So you can see and you can find all the different biomarkers that we already know from research that we must regulate them in order to help a person to go through the addiction. Obesity, you see, the system of dopamine. Video game playing and gambling, again, the system of dopamine is involved. So we can conclude today and say that we believe that an abnormal system, reward system, related with dopamine is common to all addictions. So this is the common thing with all different types of addictions. The reward system, as we know, is very, very important for survival. It's something that gives us pleasure, make us feel good and feel better. It's not so simple as we say. Concerning the addictions, there are 3 different subsystems related with the reward. The first one is the one we call it liking, the second one is wanting, and the third one is the learning. At the first one, people are very satisfied with their addictions. They like what to do. So at that stage, most probably, we will not meet patients. But from the second one, from the wanting, that means that become a habit, and the learning until they already have automatized what they do. So it becomes in a different part of their brain. At this third stage, most probably, we're going to see them. We have already many fMRIs on these different types, and if you go through the PubMed, you're going to see that about what is liking, the first stage that people are satisfied with what he does. Second one is the wanting, which can be conscious and unconscious at the same time. And the third is the learning, is when the person already knows and do this habit without thinking anymore. And the people, they say that I open the fridge and I eat, or I take my cigarettes and I smoke. So automatizing is good and bad at the same time. Good is because we learn a language, for example, we don't need to remember the different words, we just talk afterwards. So this is a good part of automatizing and learning. The bad one is the one we said before, with a bad habit. But as we learn to do something which is harmful for us, we can use learning components in order to change this procedure again. And all the therapies that are related with psychotherapy or kinesiotherapy or music therapy, they use exactly this part of the addictions in order to change, to reverse this interaction. So we call it a neural network system of our brain. So we use this system in order to have one addiction, and we're going to use the same system in order to forget this habit. How can we do that? With acupuncture, it's very important because we have all the knowledge concerning the physical pain, so we can use all this data in order to help people stop their pain. And then we're going to add some more treatments from other modalities, not only from medicine, in order to help people to change the learning procedures. Another thing, another part of addictions that we can also help is the withdrawal symptoms, the symptoms that the person has when trying to change his behavior. Some of those, they cannot sleep. Some of those, they are more unhappy. They have more depression. Some of them, they start another addiction. They start eating or doing something else. So we will see if acupuncture could be helpful on withdrawal symptoms too. What we know today is that acupuncture can minimize different types of pain. And as we believe today, addictional behavior is a kind of pain. So most probably acupuncture can help. And you saw even earlier this day, that in different guidelines we have seen depression and substance abuse. But we cannot just call it substance abuse, but we should call it addictional behavior. And this is the same for food, as we said before, or for the computer or internet use. That means that we can help patients with different type of habits in order to help them and stop them. Also, we can go to different withdrawal symptoms like headaches, insomnia, and everything, and help these patients with these symptoms. So finally, we regulate the body and we make them think better, feel better, and slowly after that change their behavior. In this type of treatments, we say that combining treatments is always better than doing only one treatment. That means that not only acupuncture can be helpful for our patients, maybe we need to combine another treatment with acupuncture to help some patients. So we cannot generalize and say acupuncture helps in all type of behavioral addictions and for all people. That's not true. We need to personalize the treatment, and we need to work together with other, most probably specialists on this topic, so we can help our patients. My time, also, we have, you can find at the internet, or you can have my presentation if you want. We have papers that they are focused on addictions and acupuncture use, electroacupuncture, laser acupuncture, ear acupuncture, but this is not the point. We cannot use acupuncture concerning only the research papers, because okay, we know that high frequencies or low frequencies can regulate some things, but psychological problems are even more bigger than what we can measure in the body. So think twice before generalize your treatment and what you're going to say to your patient. So, as we said before, combination of treatments has been proven that is better, always better, than just using one kind of treatment. So acupuncture is very helpful, but in some people, for some people, it's better if you ask them what they would like to do. Psychotherapy, maybe. Some they prefer to do sports or start changing other everyday habits, and this helps them a lot. So you need to find out what else they can do. A very easy tool that you can use in the clinic is what we call it trans-theoretical model of chains. It's very easy. Doctors can use it easily in an everyday clinic. And using this, we just divide our patients in 5 different sub-stages. At the first, they're very happy. They don't want to quit. At the second one, they want to quit, so they will come to your clinic and they ask for help. At this stage, most probably they have not done any previous try to quit. But at the third stage, most probably they have already one effort that it wasn't successful at the past. They tried to quit, for example, and they didn't succeed. At the fourth stage, they have done more than one try to quit. And the last one is 6 years after they have already quit. That means that quitting something is not just stopping the substance or the habit. For example, for smoking, stop using cigarettes does not mean that the person has go through the addiction. No. We need 6 more years, so the behavior will be completely changed, and then we can say that we are safe to say that this person is okay, free from the previous behavior. But people, they do not know that, and most of the times they come, they do 2 or 3 treatments, they stop, quit smoking, yeah, and then they start it again. Because the mental and the behavioral change is something that needs time and goes further than the simple thing, which is quitting the substance. So, commonly points that we use in clinics, I have 10 more, 20, not 30. It was 20. Yes, it's already 20, but the time is 30. So the common points that are on the research, if you see at the papers, are the same points that we use for physical pain, similar points. Of course, we can add and personalize our treatments concerning that the symptoms that the person will come and complain about, for example, insomnia or different types of eating disorders. So we can combine. There is also the NADA protocol, most probably you know. The good thing with this protocol is that we use only ear points. I'm going to show you the points. You can use 3 or 4, 5 points of